Welcome back. Many of us are still hyper vigilant and focused on our health. What are the trends heading into 2021 for our health and our home? Well, we have them for you right now.
Dr. Harvey W. Kaufman, Senior Medical Director, Head of the Health Trends Research Program for Quest Diagnostics, joins us now with survey results and to talk about why it's important for Americans to get back to care. Thank you, Dr. Kaufman, for joining us here on Park City Television.
My pleasure to join with you today.
So women are disproportionately bearing the negative impacts of the pandemic. Can you tell us what the survey revealed?
Yeah, Christine, so let me first start with what the survey is about. So we were guided by our mission to empower people to improve their health, to take control. And so we collaborated with the Harris poll to survey more than 2,000 American adults across the spectrum, across the country, to sort of dive deeper into the real issues that people are facing during this catastrophe of the pandemic. And as you mentioned, one of those findings is that women feel more stress. They're feeling more of the mental health and physical health conditions compared to men. And they're also bearing more of the financial hardship. Now, one of the reasons is women tend to be more of the caregivers in their nuclear and extended families, and they put those interests first. And so they neglect their own health at their own peril and at the peril of their loved ones.
You know, fear of exposure to COVID-19 is leading many Americans to delay routine or preventative care. What is the potential impact of these delays?
So Christine, in the survey, we found that 60% of Americans said that they had skipped or delayed an in-person medical treatment so far during this pandemic. And as a consequence of this delay of this, a lot of people, is that some health conditions will progress to a more advanced stage, will require different therapy, a more aggressive therapy that may be less responsive. And some people will unfortunately suffer the ultimate, which is death, because of the delays in diagnosis and treatment during the pandemic.
And, you know, tell me more about who's at risk most of delaying care. You know, it makes sense that we're delaying care, but it is a huge problem.
Christine, indeed it is. So it's really everyone. We've looked at the Quest Diagnostics data, and there's a gap in testing for lead in pediatrics and infants and toddlers. There's a gap in testing for chlamydia and gonorrhea of young sexually active women. And as we move further in the age spectrum, there's adults who are missing testing for hypertension, diabetes, chronic kidney disease, and many other health conditions. And if we focus on cancer, there's gaps in care in terms of screening for cervical cancer, prostate cancer, colorectal cancer, mammographies for breast cancer, colonoscopies, and even vaccinations.
And fear of exposure is also preventing people from getting tested for COVID-19. And what did the survey show?
Christine, it's one of the more shocking numbers in that 74% of people who felt that they needed, these are people who felt they really needed a test, either delayed or didn't get one. So they're putting themselves at risk. They're also putting at risk their family and their communities. Because if someone's not diagnosed, they can spread the infection to others who may suffer more severe consequences of the infection. And further, if someone waits until they're in respiratory distress, they're more likely to end up in an intensive care unit. Again, need more aggressive therapy with worse outcomes.
After 9 months of dealing with COVID-19, what lessons have we learned and what do Americans need to know?
Christina, I think that's the best question in terms of reflecting back on what we've learned. We learned so much about the virus itself, SARS-CoV-2, so much about COVID-19, the disease, and effective treatments, and unprecedented speed in development of a vaccine and rolling it out so quickly. That's the science in medicine. And what this Quest Diagnostics Health Trend Survey points to is really what's in our hearts and what's in our mind. And what's in our hearts and mind is fear, anxiety, stress, concern, and we need to confront that with facts, that really life is safe in a healthcare setting, that one can go to a doctor, one can go to a patient service center, one can get a mammogram And one of the sites that is available is our own, questdiagnostics.com/peace of mind. Provides great information to reassure people that things are safe. We've learned a lot during this pandemic, but we also need to overcome our fears, overcome our anxieties, and re-engage, get control of our health. Eat well, exercise, and get appropriate screening. Otherwise, Christine, we're going to have a tsunami of people who will have more advanced disease later on. So we need to address that now. So thank you very much.
Well, thank you so much, Dr. Kaufman, for joining us today here on Park City Television and giving us this important information about our health and how things have been affected throughout the pandemic.
My pleasure.